Hey, good afternoon. My name is Kirill. It's great to be back. Thank you for fitting me into the schedule, Amber. And since I'm on the topic, very grateful to be supported by SLC6A1. Connect, I recently got a small postdoctoral grant from AAS, and both GABA variants and SLC6A1 Connect helped me get that funding, so I'm really appreciative of that. So I am a postdoctoral fellow in Katty's lab. It's great to go right after she presented. Today I'm going to talk about the S295L variant, focusing on the mouse model. I am seeing why everyone else is having an issue. So I think we talked about this mutation that Maxwell has in detail. So I'll just skip to what kind of this representative figure of what the mouse is like. As Katty mentioned, the mouse has absence seizures, similar to Maxwell, similar to the patient, with a characteristic spike with discharges, which we've published. And Karishma has done the experiments to show that there are some behavioral abnormalities, including reduced movement and sleep disorder. And then, as far as the cellular and brain pathologies are concerned, we've shown trafficking pathology, whereby the mutant protein is stuck in the endoplasmic reticulum in neurons and astrocytes as well. There is also likely, as a result of that, there is reduced GABA uptake and then reduced expression of GAT1 on the membrane. There's increased extracellular GABA, as has been just shown in those microdialysis experiments. And so when I joined the lab, I wanted to know what effects this has on the GABAergic signals that the postsynaptic neurons receive. So I wanted to focus on the synapse, and I'm going to go through some of the data I showed last time, so I think most of you are probably familiar with this, but basically I used ex vivo electrophysiology, where I cut acute brain slices from the knock-in mice and their wild-type siblings. In this experiment, I'm recording from layer 2-3 pyramidal neurons from single neuron while stimulating layer 1. And so in these evoked responses that I looked at, these are large synaptic evoked responses, I saw that the duration of synaptic events in the heterozygote is greatly prolonged, as you can see here, right? And then the decay time is longer. And I actually saw I did a similar experiment where patched the same cells but stimulating a different region, and this was kind of a preliminary experiment that led up to the one I just showed you. But I also saw that both the heterozygote and then the homozygote that I included here kind of had this prolongation in the synaptic currents. And when I washed on tiagabine, so I got one blocker, this response in the wild type was prolonged, and then the heterozygote was prolonged as well, but this prolongation was much greater in the wild type, so sensitivity to tiagabine was much greater there, which makes sense because there's a lot more functional GAT1 that can be affected, and that sensitivity is quantified here. And if we superimpose all of these together, you can see where wild type event looks like this, and then if you add on tiagabine that blocks GAT1, it's greatly prolonged. And then the heterozygote's kind of between these two states. And if you block GAT1 and heterozygote, it also goes here, essentially. And so these are these large evoked responses, but I also looked at spontaneous synaptic events where similarly I saw this prolonged duration of these events. And there was also increased sensitivity. Well, there was sensitivity to tiagabine in the wild type, and I didn't see any sensitivity to tiagabine in the heterozygote. But this was much smaller in these smaller synaptic events than in these large evoked events, and that's most likely because diffusion plays a bigger role in clearing GABA here. And I also looked at wild type versus homozygote mice, basically with a similar experiment, and I found a similar result where these events were prolonged. And so quite consistently, I'm seeing prolonged GABAergic synaptic currents in S295L mice, both heterozygote and homozygote mice. Another aspect I wanted to look at was at tonic inhibition. I think we've talked a lot about it today and how there's this big hypothesis that it's a significant component of pathology in these mice. And this comes, for instance, from studies in a knockout animal where GAT1 is knocked out, or in multiple brain regions in hippocampus, in ventrobasal thalamus, and in cortex. And these are just some of the studies. There might be a few more. And then, of course, Michael Kavanagh actually has looked in the internal cortex in S295L mice to find an increased tonic current there. And when we try to relate these tonic currents to why these mice and the patients might have seizures, it actually does tie into the pathology of absence seizures, because absence seizures arise in the corticothalamic-cortical circuit, and actually, specifically in thalamus, increased inhibition can drive this oscillation. So I looked both in cortex and in thalamus to see if tonic currents were changed there. And this I undertook this before the experiments I showed you previously, but I did not find a change. So in cortex, looking in layer 6, I looked at 2 different ages, 2 to 3 months old and 7 months old. When I was actually doing these experiments in cortex, I tried to largely study the homozygote mice, because I thought that there would be possibly a larger tonic current to discover there, but I didn't find one in cortex. And then I looked in thalamus, comparing heterozygote mice to wild-type siblings, and I did find a tonic current there, which is normal because there should be a pretty high tonic current, even in wild-type in thalamus, but I didn't find a difference, which I thought I would. Recently, I've actually come back to this experiment where I'm again looking in this brain region, but I've changed the parameters. Particularly, I started looking at physiological temperature, because I thought maybe I wasn't looking in physiological-like conditions to find a change. But so far, this preliminary data has not been showing me, if anything, there's like a decrease here. I obviously need to keep doing this, but so far, I'm not finding a tonic current. Across the experiments I've done, the most consistent phenotype I'm finding is this prolonged iPSC decay. And this has all been, most of this data I've shown last time. And what I've wanted to do this year is to see, out of the phenotypes I've discovered, if PBA can actually ameliorate any of those, because we know in this mouse model it can help with the seizures. So we talked about, again today, PBA has a number of different roles. In particular, the 2 best well-known ones are that it can act as a chemical chaperone and that it can act as a histone deacetylase inhibitor, so it can help increase transcription of different genes. It might also have some direct effects by binding to GAT1, as Michael talked. From experiments we've done, which Katty's just shown you, a treatment with PBA can help with seizures in these mice, with the trafficking pathology, with the decreased GABA uptake, and with GAT1 expression. So, and of course, as Dr. Greenspan has shown, the clinical trial with PBA is showing a lot of promise, particularly for patients with SLC6A1 mutant genes. So I wanted to know, for the phenotype I found at the synapse, what does PBA do? So the first experiment I did, we did 2 different treatments, similar to as Katty's shown with behavior. We've done either a 7-day short treatment where we injected PBA IP, and for the study we published on its effect on seizures, this was enough to help with the seizures in this mouse model. But then we also did a more chronic treatment, and this was the one that actually helped with some of the behavioral phenotypes that Karishma's been testing. We did an oral treatment for 28 days. So in both of these mice, I basically looked at evoked GABAergic postsynaptic currents. And long story short, this blue is wild type, and then the red is the heterozygote, and then the light green is the heterozygote with 7-day treatment, and dark green is heterozygote 28-day treatment. I actually did not see a rescue of this phenotype with these treatments. As a matter of fact, if you look here kind of with some expanded data, or here's the treatment, so either no treatment, or 7 days of treatment, or 28 days. So you can see if the wild type that's been treated with PBA also didn't change, and this difference between wild type and heterozygote persisted with 7 days, and it persisted with 28 days, and also the effect of tiagabine seemed to be pretty consistent, where the wild type is quite sensitive to tiagabine, and then the heterozygote is less sensitive to it, whether it's been treated basically or not really. But so these are these large evoked events. I also looked at the smaller spontaneous events, which is when cells are firing on their own. And there, I actually may have identified a partial mild rescue with a longer treatment of PBA, as you can see here. So the red is the heterozygote, light green is heterozygote treated for 7 days, and dark green is 28 days. So possibly these events are coming back to the wild type kinetics. Here it's kind of expanded for the different days I've done, and the controls included with each. This experiment ended up being a little bit dirtier than I'd like, which is why I included this full thing. Probably don't have time to dissect it all now, but my poster's outside, and I'll be also presenting it at AAS if you guys want to come by. Yeah, and the last thing I'd like to talk about is while doing that experiment, and especially when I'm doing this experiment, I'm cutting the slices from treated animals, and then they're sitting in solutions that I've prepared to preserve, to keep them alive, and then I make my recordings. So the PBA that was there in the animal probably gets washed out, and we're really looking for the effects that PBA had on protein expression and so forth while the animal was being treated, but not during the time I'm making the recording. So if PBA is actually having some sort of an immediate effect, I'll be missing that. And so I wanted to see if that's the case, especially having followed Michael Kavanagh's work. So I also did a wash-on of PBA just acutely. And I did that both for the evoked and the spontaneous events. I did this more of a like preliminary smaller scope study, and basically didn't see much of an effect. So here are the evoked events from wild type or heterozygote. I think the thing to pay attention to is right here. Here's the sensitivity of decay to washing on of PBA, and the decay didn't really change either in wild type or the heterozygote when I washed on PBA. And when I looked at spontaneous iPSCs, I didn't really see an effect. In the heterozygote, it looked like the decay increased a little bit in the wild type. I'm not exactly sure what to make of that. It's a pretty low end for this part as well. I was really thinking the decay would decrease for the heterozygote if there's a rescue effect, but I did not see that. So with this, I'd like to come back to the model of what we know about this mouse so far. And the most consistent thing I've been finding is this prolonged iPSC decay pathology, which PBA treatment seems to partially rescue. There are a lot more questions I have. I have some questions about whether or not there's actually depletion of GABA, which I haven't looked at, but I will in the future. If you keep making the cell release GABA, will it run out much faster if it's from an S295L mouse? And I want to look some more at tonic inhibition and tonic currents, because even though I haven't found an increase in these, there's a wealth of evidence that it still might occur in this mouse model. So I'm looking at that as well. So with that, I'd like to close. Thank you very much. I'm very grateful for the help from my lab, my colleagues. We just did this lab photo where we all look great, so we can look at that. I did this slide relatively briefly, so again, I didn't put SLC6A1 Connect here. I should really have thanked more people, both GABA variants and SLC6A1 Connect. It's been great coming here year after year, being able to speak, and the feedback I get from being here, especially from Michael, is great. So if any of you have anything to say, I mean, I don't have time for questions now, but catch me during the reception later or during AAS. Okay, thank you.